Canada has secured 2 million doses of the Covishield vaccine through an agreement with Verity Pharmaceuticals and the Serum Institute of India. With the vaccine now approved in Canada, our first shipment of 500,000 of these doses will arrive within weeks. The remaining doses are scheduled for delivery over the next couple of months. These 2 million doses are in addition to the 20 million doses we've already secured with AstraZeneca that will start arriving in the spring, and any AstraZeneca doses that Canada receives from COVAX will be added to that total. So there are a lot of numbers out there. Here's the bottom line. With Pfizer, Moderna, and now AstraZeneca, Canada will get to more than 6.5 million doses by the end of March. And there will be tens of millions more doses to come between April and June. I want to express my appreciation for the support and partnership of the Indian government in fighting COVID-19 and helping secure these doses for Canada.
The production capacity of India is one of the best assets the world has today, and I hope the world understands that it must be fully used. Say a very important element of democratization of access to medicines all over the world. I appealed once again today for licenses to be made available in order for companies around the world to be able to produce some of the vaccines that already exist. I know that in India there is a production, a very high level of production, both of Indian developed vaccines, and I think there is a perspective, very important perspective of also others, and we are in contact with Indian institutions for that, and we strongly hope that India will have all the instruments that are necessary to play a major role in making sure that a global vaccination campaign becomes possible. I think that the production capacity of India is one of the best assets the world has today, and I hope the world understands that it must be fully used.
What we've seen today is reassuring. It demonstrates again the strength of India's innovation and pharmaceutical sectors. It demonstrates again India's leadership of the world, because without what we've seen today, I think many countries around the world would suffer in terms of delays and access to vaccines. There are many vaccines being produced in countries around the world, but there's only one country that has the manufacturing capacity to produce sufficient quantities to satisfy the demand of citizens in every country, and that's India. You know, this is another example of a moment in which India will shine because of the strength of this sector and the planning that's gone in. And I suppose that's not unexpected from a country that itself has suffered so many pandemics in the past. The takeaway is that it's not just about the manufacturing process, but also about logistics, and it's good to know and good to hear that the centre is talking to the states and working hard on getting those logistics right for India, but also
many millions of followers here, and we're talking about Indian issues in particular of late. Sadanand Dume is our resident scholar in Indian studies, and he has a question about that country.
I can hold this. Thank you very much. I have a broad question about India. When you look at your engagement with the country, what do you think it's done well, and where do you think it needs to do the most work?
Well, India has a lot of very socialistic policies having to do with labor and land, and the fact that it has not risen as a manufacturing power is an indictment of its government policies. That is, as China's incomes went up, the place that the world should have moved to next as the manufacturing hub of the world absolutely should be India. And that's only happening to a very, very tiny extent. And it has to do with, regulatory complexities, infrastructure quality. Now, I'm optimistic about India. We put more into India than any country in the world. India benefits from a funny form of competition, which is competition between the states. And so, when one state really gets its act together, the other states tend to feel jealous, and they, are kind of looking at what policies led to that. The states in the north that we're particularly focused on, Bihar, Uttar Pradesh, have lagged in every human development numbers as well as income. But the improvements, and we have a big partnership with Nitish Kumar as Chief Minister in Bihar. The new Chief Minister in Uttar Pradesh decided that these health things that we care about, he'd get very involved with. And so we're seeing a very fast rate of improvement there.
Tonight, I want to begin with some good news. India has found an effective weapon against the mutations. It's called Covaxin, the Made in India shot. The latest tests show that Covaxin is effective against all mutations. It's the jab being produced by Bharat Biotech, one of the two vaccines being administered in India. The other, as you know, is Covishield. So here's what we know about Covaxin now. It has an efficacy of 78% in general, and an efficacy of 100% against severe infections. So if you get this shot, Covaxin, you'll most likely not end up in hospital. That is, if you contract the virus. And here's the biggest takeaway from the Covaxin trial. The vaccine works against mutations too. All the variants you've been hearing about, the UK variant, the Brazil variant, the South African variant, even the double mutant, the one that's said to be driving India's second wave, Covaxin should work against all of these. This is according to an interim analysis of the final phase of trials, that is phase 3 trials. The final report on this is expected in June. And that's when the findings will be submitted to a peer-reviewed journal for publication. Nonetheless, these results are very promising. How does this compare to other shots? Take the case of Pfizer. It has an effectiveness of 95%. It works well against the Brazil and UK variant, but according to an Israeli study, the Brazil variant could break through the protection of the Pfizer shot. Again, this does not mean that the vaccine is not going to help you, but it may be less effective. Either way, Pfizer does not want to take any chances. It is now looking into what a third dose might do, a booster shot as they call it. That could be given 6 to 12 months after the first 2 doses. Pfizer is conducting a study into the need of the third dose. Then we have Moderna. It is also considering similar possibilities. It reported a more than 90% efficacy for its shot, but it is testing the use of a third dose. Also a booster shot that targets the South African variant. How do the other vaccines fare? Sputnik V, for instance. The makers of this shot say their vaccine is more effective against mutations. That's because it's the only vaccine in the world that uses 2 different kinds of shots. Here's what happens in other vaccines. You get 2 doses of the same vaccine. But in the case of Sputnik V, the second dose is slightly different from the first. And this combination is supposed to prevent the second shot from neutralizing the immunization effects of the first one. Essentially, the purpose remains the same. It's the approach that is different. A study found that Sputnik V has a 92% efficacy rate. What about AstraZeneca, the one that we call Covishield in India? This shot has an overall efficacy of 76%, but it was returned by South Africa. That's because the vaccine was not very effective against the South African variant. Reports say the company is now making a modified version of this vaccine. It should be ready by the end of 2021. And finally, we have Johnson & Johnson, the only single-shot vaccine in the world so far. An overall efficacy rate of 72%. Its trials happened when the South African and Brazilian variants had already spread. So we have some specifics here. This shot, Johnson & Johnson, was 64% effective in South Africa and 66% effective in Brazil. All these vaccines still have to be tested against the double mutant, and now the triple mutant, which has been found in India. But here's what we can say for sure. Any vaccine is better than none. Go and get what you're getting. And I know what some of you may be thinking. People are testing positive even after vaccination. So how does it help? Let me show you some data. As we told you before, India is using two vaccines, Covishield and Covaxin. More than 100 million people have got Covishield and over 10 million people have got Covaxin. So we have data for more than 110 million people in India. Do you know how many vaccinated citizens, those who got both the doses, have been infected by the Wuhan virus? Not even 0.1%. A little over 17,000 people got infected after taking one shot of Covishield. That's 0.02% of the total. Similarly, about 4,200 people got infected after their first shot of Covaxin, 0.04%. What happened after two doses? The results are better. In the case of Covishield, a little more than 5,000 were infected. That's 0.03% of the total. And in the case of Covaxin, just 695 or 0.04% people. Well, this should tell you how vaccines...
Meanwhile, remember, India is, of course, the world's biggest pharmacy. And it is at the forefront of fighting the COVID-19 pandemic as well. And it is receiving praise from every quarter for its ability to, in fact, ramp up production of the COVID-19 vaccines. And it is no less than IMF's chief economist, Geeta Gopinath, who said that India's COVID-19 vaccination drive is actually one of the best in the world. Now, India has launched the world's biggest vaccination campaign in the month of January, and since then it has managed to inoculate millions of frontline workers and also the vulnerable section of the population. And India's effort has been hailed across the globe. On Monday, IMF's chief economist Geeta Gopinath lauded India's vaccine manufacturing capacity. She said, and I quote her here, "The India really stands out in terms of its vaccine policy. If you look at where exactly is one manufacturing hub for vaccines in the world, then that will be India." Now, Geeta Gopinath made these comments while addressing a lecture on the occasion of International Women's Day. The Serum Institute of India found a special mention in Gopinath's lecture. She also said that the Pune-based manufacturer produces the most number of vaccines in the world in a regular year and has now been manufacturing the COVID-19 vaccines as well that are being delivered across the world as part of the United Nations COVAX program. In the last few months, the world has, of course, taken note of India's vaccination drive. International publications have said that India has, of course, set up a model for the world to follow. It has sent indigenously manufactured vaccines to over 16 nations so far, and according to WHO's chief, Dr. Tedros Adhanom Ghebreyesus, India has, of course, set an example for the world to follow. And this is not a recent happening. Remember, for many decades, India has, of course, been at the forefront of vaccine manufacturing. Earlier in January, America's businessman and philanthropist Bill Gates had also appreciated India's leadership efforts and vaccine manufacturing capacity. He put out this tweet where he had said that it's great to see India's leadership in scientific innovation and vaccine manufacturing capability as the world works to end the COVID-19 pandemic. Another thing to note here is that the Bill and Melinda Gates Foundation has also tied up with the Serum Institute of India to speed up the manufacturing and delivery of nearly about 100 million doses of vaccines as part of United Nations COVAX program. Now, India has two vaccines that have been approved for emergency use, Oxford's AstraZeneca's Covishield and also Bharat Biotech's Covaxin, and both of these jabs are being produced in India. Now, talking about Covaxin, one of the world's most prestigious medical journals, The Lancet, has now declared India's indigenously developed vaccine to be safe, immunogenic and with no serious side effects. The Lancet made no mention of Covaxin's efficacy. It said that it could not be determined by phase 2 trials. However, in some pretty great news, the medical journal further said that Covaxin is effective in neutralizing Britain's highly transmissible mutant variant of the coronavirus.
It's the 23rd of January 2021. Let's rewind a little. 10 months ago, New York-based Foreign Affairs magazine predicted a catastrophe for India. 4 months later, the Boston Review called India's Wuhan virus response a quote-unquote humanitarian disaster. In August 2020, the Scientific American claimed India is in denial about the COVID-19 crisis. The BBC was quick to declare that New Delhi is staring at a disaster. This headline is now 3 months old. The pandemic in India, more than 10 months old. A year and a month have passed since the first case of the Wuhan virus was reported in China. A year and 10 days since the first case was reported outside China. Look at what the BBC has to say now. The UK reports a record 1,564 daily deaths. A further 1,564 people have died in the UK within 28 days of a positive COVID test, the biggest figure reported in a single day since the pandemic began. The CNN reports that UK hospitals look like a war zone. And just so that you know, hospitals in the US are not keeping too well either. Over 24 million people have been affected in the United States so far. That's more than 25% of the global caseload. Hospitalizations are up in Hawaii, Kansas, New Jersey, Kentucky, Pennsylvania, Vermont, and Maine. California is the new hotspot. And the West as a whole is all over the place. India, on the other hand, appears to have got a grip on the Wuhan virus pandemic. Cases have fallen to the lowest since June 2020. So much for the doomsday predictions. As we speak, India is also driving the world's largest vaccination program. 1.3 billion people are slated to be immunized. 1.04 million people have been vaccinated as of the 22nd of January. By July this year, India plans to vaccinate at least 300 million people. That's almost the entire population of the United States. India has trained 200,000 vaccinators, 370,000 team members, ready 29,000 cold storages, and India is not done yet. India is not just vaccinating its own, but also nursing the neighborhood back to health. India's vaccine diplomacy is what we will focus on this episode of Gravitas Plus. Hello and welcome. I'm Palki Sharma Upadhyay. As we speak, Indian vaccines have reached these countries. India gifted 150,000 doses of Wuhan virus vaccines to Bhutan. The consignment landed on the 20th of January. 100,000 doses of the Covishield were gifted to the Maldives. 1 million doses of the vaccine were gifted to Nepal on the 21st of this month. On the same day, an Air India flight carrying 2 million doses of Covishield also landed in Bangladesh. On the 22nd of January, Indian vaccines reached Myanmar, Seychelles, Mauritius, Brazil, and Morocco. Myanmar received 1.5 million doses, Seychelles 50,000. All of these were free of cost. Sri Lanka and Afghanistan are next on the list. India is looking to donate around 10 million doses of vaccines. The jabs will cover healthcare providers, frontline workers, and the most vulnerable people in these countries. This is India's hashtag, Vaccine Maitri. Now just take a moment and think about this. The world's so-called developed nations are focused on their own problems, overwhelmed by the pandemic, while India is nursing other countries back to health. Even in times of a deadly pandemic, India is looking at her neighborhood first and healing the region with the highest population density. The demand for India's vaccines, however, goes beyond SAARC and beyond the subcontinent. Brazil and Morocco have just received their shipments under commercial agreements. Brazil bought 2 million doses of Indian vaccines, as did Morocco. The UK and Belgium have shown interest in buying vaccines from India. Dominica has sent an SOS letter to the Prime Minister of India, Narendra Modi. Prime Minister Roosevelt Skerritt wrote, "I request with great humility and respect that you assist us by donating the doses we need to make our population safe, optimally 70,000 first and second doses." Other developing nations like South Africa, Kenya and Nigeria are looking forward to Indian vaccines, as are many West Asian countries, including Saudi Arabia and the United Arab Emirates. Why is the world interested in Indian vaccines? A, they're cost effective, and B, they're safe. The Moderna vaccine, for example, is expected to cost around $30, Sputnik V around $10. Now compare this to Covishield from India, approximately $6. Did you know India is home to the largest number of US FDA-approved vaccine manufacturing plants? Indian firms have a reputation for top-notch standards. If you watch WION, you would know this by now. India is known as the world's pharmacy. Vaccine developers from around the world have been tying up with Indian plants since the beginning of the pandemic. These are some of India's renowned vaccine manufacturers. India's pharma sector caters to 50% of the global vaccine demand, 40% of the generic demand in the United States, and 25% of all medicines in the UK. Indian drugs are exported to more than 170 countries globally. India is also home to the world's largest vaccine manufacturer, the Serum Institute of India. It produces 1.5 billion doses of vaccines every year. The UK's GlaxoSmithKline, in comparison, manufactures 0.69 billion doses. Sanofi from France manufactures 1 billion doses. America's Merck and Johnson & Johnson produce less than 0.2 billion doses every year. The Serum Institute of India is currently manufacturing the Oxford AstraZeneca Covishield vaccine. It will also supply 200 million doses of vaccines to the COVAX Alliance to distribute vaccines to poorer countries. India is ensuring equitable distribution of vaccines. As India's Prime Minister said, India is ready to save humanity with 2 made-in-India vaccines. India's vaccine diplomacy, on the other hand, will generate goodwill with the world. Bill Gates recently posted this. It's great to see India's leadership in scientific innovation and vaccine manufacturing capability as the world works to end the COVID-19 pandemic. Even WHO Chief Dr. Tedros heaped praise on India. Let me quote, India continues to take decisive action and demonstrate its resolve to end COVID-19 pandemic as the world's largest vaccine producer. It's well placed to do so. It looks like the praise did not go down too well with China. One day after Dr. Tedros' testimony, China's mouthpiece, the Global Times, published this article. Don't go by the headline, read the text below. India hopes to counter the international influence of Chinese vaccines, even if China has always set its own pace and has no intention of competing. You see, China has a limitless checkbook. India has a robust infrastructure for vaccine manufacturing. While China tries to buy support, India is enhancing its global influence by extending support. China wreaked havoc in Nepal. India is healing Nepal. China debt-trapped Sri Lanka. India is trying to free Colombo from the clutches of the pandemic. China lied to Bangladesh about 110,000 doses of free vaccines. India sent 2 million doses of vaccine to Dhaka for free and without any clauses attached. China haunted the Maldives with repayment notices in the middle of the pandemic. India, on the other hand, is helping the country kickstart its tourism-driven economy by vaccinating the population. It is the first country to offer free vaccines to multiple nations. China had promised free vaccines to Myanmar, Cambodia, and the Philippines. Last we checked, it remains just a promise. The truth is, the world is turning away from Chinese vaccines, like all things Chinese. The developed countries of the West are turning isolationist. India is slowly but surely stepping into a leadership role here and displaying compassion, the kind of which has never been seen before. Look at what Bhutan's Prime Minister, Dr. Lotay Tshering, had to say. It is of unimaginable value when precious commodities are shared even before meeting your own needs, as opposed to giving out only after you have enough. Maldivian President Ibrahim Soli called India's vaccine consignment the most generous gift. Nepal's Prime Minister KP Sharma Oli posted this. He said Nepal appreciates the gesture from a friendly neighbor. Bangladesh's Prime Minister Sheikh Hasina has also thanked India's Prime Minister Narendra Modi. Without India, there won't be enough vaccines to save the world. This is from the director of the London School of Hygiene and Tropical Medicine. He said this as early as July. While the world blocked export of essential medicines, India supplied hydroxychloroquine, HCQ, remdesivir, and paracetamol tablets. New Delhi also exported diagnostic kits, ventilators, masks, gloves, and other medical supplies. India provided training to its neighborhood, and now India is saving the world with its vaccine. Because here is one thing that India believes in: Vasudhaiv Kutumbakam, as we say. The world is one family.
Distinguished delegates to the World's Parliament of Religions, ladies and gentlemen, welcome to the afternoon session of the opening day today, the 11th of September, 1893. We now introduce you to Swami Vivekananda from India and request him to address us. Swami Vivekananda.
Sisters and brothers of America, it fills my heart with joy unspeakable to rise in response to the warm and cordial welcome which you have given us. I thank you in the name of the most ancient order of monks in the world, I thank you in the name of the Mother of Religions, and I thank you in the name of the millions and millions of Hindu people of all classes and sects. My thanks also to some of the speakers on this platform who, referring to the delegates from the Orient, have told you that these men from far-off nations may well claim the honor of bearing to different lands the idea of toleration. As the different streams, having their sources in different places, all mingle their water in the sea, so, O Lord, the different paths which men take through different tendencies, various though they appear, crooked or straight, all lead to Thee.